Welcome to my channel. After conception, every mother is very anxious about her delivery. Many problems arise from cesarean delivery and there is a lot of pain associated with normal delivery. Which one is best for me, a normal delivery or a cesarean delivery? They are concerned about all of this. According to World Health Organization, cesarean delivery can be performed only in case where the life of the baby and the mother are at risk. But currently, the rate of cesarean deliveries has been increasing day by day. Everyone complains that nowadays hospital and clinic are not performing normal deliveries without cesarean deliveries, even though the number are small. What the real reason behind this? Is cesarean delivery performed due to clinic or hospital being more interested in business than in addressing the problem of the baby or mother? If the baby or the mother is in trouble, how will you determine if a cesarean section is necessary? So, in this video, I will discuss about what is the indication of cesarean delivery, what should you see an ultrasound report to understand if a cesarean delivery is needed, in which case can a normal delivery be possible. So, let's get started. Before that, we need to understand what normal delivery and cesarean delivery are. Normal delivery is a natural process where childbirth occurs through the vagina without any medical intervention. Look at the picture. Cesarean delivery is a surgical procedure in which a baby is delivered through incision in your abdomen and uterus. Now let's discuss when a pregnant mother needs a cesarean delivery. The reason for cesarean delivery can be divided into two categories. Number 1, elective. Number 2, emergency. Elective means planning for a cesarean delivery before the onset of labor pains. Among the reasons for elective cesarean delivery, number 1, cephalopelvic disproportion. Our body have two pelvic bones that form a cycle structure called pelvic cavity. During delivery, the baby's head passes through the pelvic cavity, leading to a normal delivery. However, if the baby's head is larger than the pelvic cavity of the mother due to some reason, it becomes stuck during delivery. The medical condition is called cephalopelvic disproportion. Cephalo means head and pelvic refers to the pelvic cavity. If the baby's head or body is large compared to the mother's pelvic cavity, a cesarean delivery is necessary. Number 2, breast presentation. Generally, in pregnancy, the baby's head is positioned downward. The baby's face is posterior, which is the normal position during pregnancy. The normal position is medically referred as cephalic presentation. Please look at the picture on the screen. The image shows cephalic presentation. On the other hand, breech presentation occurs when the baby is in ups and down position. If the baby's head upward or baby is in transverse position is called breech presentation. Sometimes even if the baby's head downward but the baby's face comes out first inside the head, it is referred to as brown presentation. Breech presentation can take various forms such as complete breech, frank breech, transverse lie, and so on. Usually, when the baby is longitudinal position, delivery is relatively easier. But if the baby is in transverse position, normal delivery can be quite difficult. Pay attention on the image. One important thing to note is that if the ultrasound show the baby is breech presentation or abnormal position after 36 weeks of pregnancy, a cesarean delivery might be necessary. However, if the baby's presentation is breech before 35 weeks, it can often correct itself. I have detailed video about baby's presentation during pregnancy on my channel and I will provide the video link in the description box. Feel free to watch if you are interested. Number 3, placental problem. During pregnancy, the fetus receives essential nutrients and oxygen from the mother through the placenta. There are many blood vessels in the placenta because the mother supply blood to her baby through the placenta. The placenta stay attached to the upper part of the uterus during pregnancy. If for any reason the placenta comes downward the cervix and covers the cervix is referred to as a low-lying placenta or placenta previa. With a low-lying placenta, the pregnant mother might experience significant bleeding. If the ultrasound report indicates low-lying placenta or placenta previa, a cesarean delivery usually necessary. Attempting a normal delivery in such case can be severe risk to both mother and the baby. Number 4. Previous cesarean section. For mothers who have undergone more than 2 cesarean delivery, their third or subsequent deliveries are often performed through the cesarean section as well. Number 5. Genital herpes. Even if a pregnant mother has a herpes infection in her genital area, a cesarean delivery is often recommended. This because attempting a vaginal delivery in such case can expose the baby to risks of infection. Number 6. Previous uterine surgery. If a woman has undergone any previous uterine surgery such as removal of uterine tumors or polyps, a cesarean delivery might still be necessary. Previous surgical procedure on the uterus can increase the likelihood of complication during vaginal delivery. Number 7. Twin babies. In the case of twin babies, breech presentation, when the baby's feet or buttock are positioned to the delivery first, can occur. In such situation, a cesarean delivery might be necessary. Now, let's discuss the various emergency reasons for performing a cesarean delivery. You might have initially prepared for vaginal delivery, but due to unforeseen complication, a cesarean delivery could become necessary. These reasons are considered emergency indication for cesarean section. Number 1. Fetal distress. If suddenly the baby's heart rate or rhythm decrease, it indicates that the baby might be facing some difficulty. In such case, doctor often recommended a cesarean delivery to ensure the safety of the baby. Number 2. Eclampsia. In the last 3 months of pregnancy, some mothers might experience swelling of the leg, high blood pressure, and sometimes seizures, which is known as eclampsia. This is a medical emergency. In case of eclampsia during pregnancy, a cesarean delivery is often necessary to protect the mother and baby. Number 3. Meconium stain liquor. During pregnancy, the baby is surrounded by a fluid-filled sac known as the amniotic fluid or liquor. Sometimes the baby might pass meconium means in stool, into the amniotic fluid. This can lead to complications such as infection or aspiration pneumonia in the baby if they inhale the meconium. If the baby shows sign of passing meconium, it is important to perform a cesarean delivery promptly to minimize sick risks. Number 4. Prolonged labor. Typically, when a woman goes into labor, she experiences contraction and the cervix gradually open to allow the baby to descend. For first-time pregnant women, labor pain can at least around 12 to 18 hours, while for those who have a second or third baby, it can last 8 to 10 hours. If labor pain lasts longer than expected, the cervix does not dilate as it should, and the baby's head does not descend, it refers to as a prolonged labor. This condition can sometimes lead to abnormal bleeding as well. In such case, an emergency cesarean delivery might be necessary. Number 5. Cord polyps. During delivery, the baby's head is usually the first to come out, but in case where the umbilical cord comes out before the baby's head, it is called umbilical cord polyps. Sometimes other parts of the baby's like hand or feet can also present first. In either case, a cesarean delivery is often required to avoid compression of the cord and potential complications. If the comment or impression section in your ultrasound report mention fetal distress, less fetal movement, meconium stain liquor, placenta previa or low-lying placenta, abruptio placenta, breech presentation, and oligohydramnions, then it would be indicate that normal delivery might not be possible. In that case, you should be prepared for cesarean delivery with the consultation of a gynecologist. If the problem discussed above are not present, then you may have a normal delivery inshallah. You trucks will be maintain patient, make pairs and seek regular advice for a qualified healthcare professional. Speaking generally, if your pregnancy reaches 35 weeks, always be mentally prepared for delivery. The estimated delivery date provided through the ultrasound might not be necessarily be the actual delivery date. In many cases, delivery could happen a few days before or after the estimated date. Whether you have a normal delivery or a cesarean section, don't be worried too much. Have complete trust in your doctor and have faith in Allah. Whether it is normal delivery or cesarean delivery, you should go to the hospital immediately when the labor pain starts. If labor pain does not start according to the estimated date, then it is advisable to consult a gynecologist 3 to 4 days from the delivery date, whether you experience pain or not. Don't wait at home for a normal delivery because it can be risky. For a normal delivery, try at hospital. If you face any complication before or after labor pain, consult a nearby hospital or gynecologist. Keep faith in Allah and prepare for easy delivery. Allah is Almighty. In the next video, I will discuss about what is the advantage and disadvantage of normal delivery and cesarean delivery. Hope today's video was helpful for you. If you find the video helpful, do not forget to share it with your friends. Please subscribe to my channel to get health advice, health awareness and reproductive health related all videos. And remember to become a member of our family. Stay with us healthy and safely. Thank you for watching this video.